Hey, you guys, welcome to day 18 of our March Madness practice questions. As always, I like to do my introduction and disclaimer before we get into the questions for today or any of our videos. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and founder and CEO of the Nursing Studio. I have been doing this since 2015, helping thousands of nurses and nurse practitioners internationally be successful on boards as well as in practice. I provide courses and videos and content just to help you guys get to the level of success you need. Started doing these videos a bit more just to kind of give you these extra tools to study on the go while you're preparing for boards or even while in school. I always like to give the disclaimer that, there's no absolutes in medicines. We treat on a patient by patient basis, but the questions that I design are based off of the guidelines that are currently being tested on our boards. If I am teaching you on material, it's going to be based off of what's currently being tested. But if I ever am teaching on things that we currently practice, I always tell you so you're able to differentiate so there's no questioning in the clarification or causing any confusion, okay? But let's get into our questions for today. All right. Question number one, you guys. All right. Question number one states the nurse practitioner has diagnosed a patient with trigeminal neuralgia. She is prescribing carbamezapine for the management and treatment of this condition. All are potential side effects of this medication except is it A, dizziness, B, ataxia, C, drowsiness, or D, diarrhea? Tell me what you got in the comments. Don't be shy. Tell me what you got. Tell me what you got. All right, you guys, I always tell you to read the stem of the question first to slow yourself down and ensure that you are answering what is even being asked of you. The question here says all are potential side effects of this medication except, right? Except being that key word that we need to pay attention to. So which one is not right, right? So thinking of trigeminal neuralgia, we know that affects cranial nerve 5. They'll have that unilateral pain, the cheek region. We know first line therapy is the carbamezapine. So yeah, we're walking through everything looks good. So then you need to know potential side effects to educate the patient on, right? A, dizziness. Is this a side effect? Yes, it is a carbamazepine. B, ataxia is a side effect. C, drowsiness is also a side effect. The answer here is D, diarrhea, because that's not a side effect. Nausea and vomiting is, diarrhea is not. So D is the one that's incorrect. All right, question number two. The nurse practitioner is discussing when to initiate cervical cytology. Uh, better, the pap smear if you're confused with the MP student based on their response, which is correct. So again, the nurse practitioner is discussing when to initiate cervical cytology with the MP student based on their response, which is correct. Is it A, once sexually active, B, 18 years of age, C, 21 years of age, or D, 30 years of age? Take a moment and tell me what you got in the comments. All right, similar question states, based on their responses, which is correct. So what are we talking about here? The nurse practitioner is discussing when to initiate cervical cytology with the nurse practitioner student. So we're trying to see when should you start cervical cytology? Is it A, once they're sexually active? No, years ago that used to be a part of the criteria and steps, but no, it's not. B, 18 years of age. Nope. C, 21 years of age. Yes, the answer is C. Remembering women that are less than the age of 21, there's no screening required. We start to do cervical cytology every 3 years for women 21 to 29. So be sure you know that. Every 3 years, cervical cytology from 21 to 29. We used to do everything annually. This says every 3 years. If there's abnormalities, of course, we'll do it sooner. Women from the age of 30 to 65 have more options because you've had the history and the ability to kind of see your pattern for your medical history. So from ages 30 to 65, we can continue cervical cytology every 3 years, or they have the option of doing the high risk HPV exam every 5 years, or they can choose to do both the high risk HPV and cervical cytology combo every 5 years. And then if you've had, normal readings after the age of 65, then you don't require further screenings. Okay, so it's just patient by patient. But answer C, we start at 21. All right, and then question number 3 for today. A patient presents to the office today for follow-up. She has a history of depression and currently takes sertraline. The patient states that her and her husband want to have children, but is concerned about the need to stop sertraline. What is the best response by the nurse practitioner? Is it A, this is safe for SSRI for pregnancy? Is it B, pregnancy is not contraindicated with SSRIs? C, we will stop the medication now? Or D, we will discuss when you become pregnant? Take a moment and tell me what you got in the comments. All right. So the stem of the question states, what is the best response by the nurse practitioner? So what are we talking about? This patient has a history of depression, takes sertraline. Her and her husband would like to get pregnant, trying to see, if it's safe for her to do so. Answer choice, this is a safer SSRI for pregnancy. A, yes, A is the correct answer. SSRIs are cautioned and contraindicated in pregnancy, right? One, we know we don't stop antidepressants abruptly. So you could have eliminated C. We will discuss when you become pregnant is not giving an answer or a solution to what we're discussing here. So you can eliminate D. And B is incorrect also. So as you could have narrowed it down to A or B, right? But SSRIs are caution contraindicated in pregnancy. But there's multiple things to know about this. Sertraline is one of the safer first line therapy for people who are pregnant with antidepressants. And if they were already on it, we don't want to stop it. Now, if this was a new diagnosis at the pregnancy or when they are wanting to breastfeed, then we would try more of the psychotherapy first, but you could still give sertraline. That's one of those safer SSRIs that have shown to have any to low response to the baby. Okay, so it's one of those benefit to risk scenarios, and it's done patient by patient. But if we can avoid it, we do. But if not, this is the route to take. You want to make sure because she is on one of the safer ones. So we're in a better situation here. And of course, if given the option, you will refer out so that they know how to manage this specifically with psych and then, OBGYNs. But this is the best answer for right here for this patient and the route to take. Okay. All right, you guys. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial. But make sure you meet me back here. We're doing practice questions all month long while you're also studying. Go check out those other videos. There's hundreds of videos to help. That's more disease specific, system specific, that gives you content, then questions, to kind of study and then practice. So utilize those if you need a little bit more work on some areas. If you need us for any of our review courses, any of our one-on-one sessions, just give the Nursing Studio a call at 803-400-6864 or shoot us an email at the Nursing Studio, the number 1 at gmail.com. Bye, y'all.